A crisis is unfolding within the U.S. Department of Health and Human Services, HHS, with over 1,000 current and former employees taking a stand against Secretary Robert F. Kennedy Jr.'s leadership. In a bold move, they've penned a letter demanding his resignation, citing his actions as a threat to the health and well-being of the nation. The letter, addressed to Secretary Kennedy and members of Congress, comes at a critical juncture for the Centers for Disease Control and Prevention, CDC. It follows a week of turmoil that saw the firing of CDC Director Dr. Susan Monarez and the subsequent resignations of 4 senior officials. Monarez's dismissal, according to sources, was a result of her refusal to yield to pressure from top HHS officials regarding potential new vaccine restrictions. Secretary Kennedy continues to jeopardize the nation's health, the employees assert, pointing to his role in facilitating Monarez's removal, the loss of key CDC leaders, and the appointment of individuals they describe as political ideologues to influential vaccine policy roles. They also highlight the rescinding of emergency use authorizations for COVID-19 vaccines without providing the necessary data or methodology behind the decision. HHS Communications Director Andrew Nixon responded to the letter, stating, "Secretary Kennedy is committed to evidence-based science and has achieved more in 7 months than any health secretary in history in the fight against chronic diseases." However, the employees remain unconvinced, emphasizing their personal capacity in signing the letter and expressing disappointment in Kennedy's lack of response to their previous correspondence. Should Secretary Kennedy refuse to resign, they write, "We urge the President and Congress to appoint a new Secretary of Health and Human Services who ensures health policies are guided by independent, unbiased, peer-reviewed science." The controversy has sparked reactions from various quarters. U.S. Senator Patty Murray, a Democrat from Washington, called for Kennedy's firing after Monarez's ouster. Senator Bernie Sanders, an independent from Vermont, echoed these sentiments in an opinion piece, citing Kennedy's anti-vaccine stance and advocacy of conspiracy theories. Representative Rosa DeLauro, a Democrat from Connecticut, also joined the chorus of voices calling for Kennedy's removal. Senator Bill Cassidy, a Republican doctor from Louisiana and chair of the Health Committee, added fuel to the fire by calling for the postponement of the CDC's Advisory Committee on Immunization Practices meeting, scheduled for September 18th. He cited serious allegations regarding the meeting's agenda, membership, and lack of scientific process, stating that any recommendations made under such circumstances would lack legitimacy. As the controversy rages on, Secretary Kennedy is scheduled to testify before the Senate Committee on Finance on Thursday, where he will face questions about the president's 2026 healthcare agenda. The outcome of this testimony and the subsequent actions taken by Congress and the White House will be pivotal in determining the future of HHS and the CDC. This story is a testament to the power of employees standing up for what they believe in and the impact their actions can have on shaping policy and leadership within critical government agencies. It raises important questions about the balance between political ideology and scientific expertise in public health decision-making. What do you think? Should Secretary Kennedy resign, or is there another way forward to restore trust in the CDC and ensure the nation's health is protected?